Begin.
Yeah.
Hello, my name is Marina. My GMC number is 1234. Hello,
Hello, doctor.
my name is Marina. I am one of the junior doctors working here in the GP practice. May I confirm your name and age, please?
I'm David Longfoot, and I'm 55 years old, doctor.
Okay, good to see you today. How do you like to be called today?
David is fine.
Okay, thank you, David. I understand that we are here for follow-up. Am I right?
Yes, yes.
Okay, yeah, that's good. Okay, so I understand that you have diabetes mellitus for quite a long time. Am I right?
Yes, I do have diabetes,
Yeah.
but it's just for uh 4 years. Yeah.
Okay, yeah, okay. So actually, we have done a blood test for you to assess your the control of your diabetes. Okay, but
Yeah.
firstly, I'd like to ask you a few questions. Then I will answer your concerns. Is that okay
Okay.
with you?
All right.
All right, thank you. So you told me that you have diabetes for 4 years, right?
Yeah.
Okay, and how are you managing with your diabetes so far?
I'm managing well. They
Okay,
advised me on diet control, and I'm
okay.
following the advice, and I think it's controlled. Yeah.
Right. Okay, that's great. Okay. So, what symptoms did you have that make you have the diagnosis of diabetes in the first place?
Um, it was just, a routine checkup, and I found
Okay.
my blood
Yeah.
sugar is
Okay.
high.
Okay, that's great. Okay. Do you feel that you go to the loo more frequent?
No,
Okay. Do you feel that you are thirsty more thirsty?
no, actually, doctor, what I feel now is that I'm tired all of the time.
Okay.
Yeah, and I'm sleepy as well.
Okay. Okay. So, this tiredness is something new for you, right?
Yes, yes.
Okay, okay, okay. I'm sorry for that. So apart from this tiredness and the sleepiness, do you have any other symptoms at all?
No,
Okay, okay. Have you had any headache at all?
no,
Okay, any weakness, any part of your body?
no,
Any shortness of breath at all?
not really short of breath, but
Mhm.
my wife told me that I'm snoring.
Okay, so think that you're snoring, that you're at night, right?
Yes, doctor.
Okay, and do you wake up in the night gasping for air or something like that?
No,
Okay, okay. That's good. Okay. So, have you noticed any infection in your food or something like that?
any?
Infection in your food?
No,
Okay. Okay. Any problem with your eye, with your
no,
vision?
no.
Right. Okay. And you told me that you are just following diet modification for your diabetes, right?
Yeah.
Okay. Do you regularly check your blood sugar daily?
Yes,
Okay. And how it's measured? I mean, what's the
the
number you
measures
have?
are the measurements were within the normal limits. So yeah, I think my diabetes is well controlled. Yeah.
All right. Okay. Okay. That's fine. So, what about your lifestyle in general? Do you eat healthy diet?
Yes. Oh yeah. I'm controlling my diet because of the diabetes. Yeah.
All right. Okay. So, and are you playing any exercise?
Not really. No.
Is there any particular reason for that? You feel busy?
Well, yeah. I'm busy by my work. So yeah,
Okay. Yeah. And what do you do for living?
I'm a taxi driver.
All right. Okay. Okay. I will come to that in a minute. Okay. But
Mm.
firstly, can you tell me, do you smoke?
No, doctor.
Okay. And do you drink alcohol?
No.
All right, okay. So you told me that you are feeling sleepy most of the time in the morning, right? Does it
Yeah.
ever happen that you slept over the morning in the morning or have any naps at all in the morning?
Yes. Sometimes I want. Yeah. I want to have naps. Yeah.
Okay, okay. And does it ever happen while you are driving your taxi or something like that?
No.
Okay, okay, that's great. Okay, so apart from that, is there anything else bothering you?
Nothing now. Just
Okay, okay, yeah, okay. So, are you sexually active?
yes.
Okay, any problem or issues with that?
No.
Okay, that's great. Okay, so may I examine you now, then we can continue our discussion. Would that be okay?
Okay.
So I'd like to check your blood pressure, and I'd like to check your oxygen saturation, your respiratory rate, and your temperature. And I'd like to check your blood glucose level once more as well. Okay.
Mhm. Okay.
We okay, yeah. So
Examinations are normal.
okay. So do you have any idea what could be the cause of your symptom?
No, doctor.
Okay, and anything in particular concerning you today, David?
It's just
2 minutes
the
remaining.
tiredness and the sleepiness.
Yeah, I
Yeah.
understand. Okay. So, all right. So, from what you are telling me, and as I told you, we did something called BMI, which is a relation between your weight and height. Okay.
Mhm. Mhm.
It is a little bit on the higher side, and it
Mhm.
should be lower than that. Okay.
Okay.
So, this might be one of the causes. That's why you are having this tiredness. By
Mhm.
that, I mean there is something called obstructive sleep apnea. Okay.
Mm. Okay.
So by
What
that
is
I
that,
mean,
doctor?
yeah, I'm going to explain to you now. Actually, if someone is a little bit on the higher side, I mean, if it is obesity, so sometimes the muscles of the mouth just relax while you are asleep, causing you this problem while you are sleeping or with your breathing, I mean, okay?
Okay.
So that's why you are snoring at night. And when you wake up in the morning, you are not feeling refreshed and you are having these naps during the morning time. Okay.
Okay. So what are you going to do for me, doctor?
Well, there are certain things that we need to do. Firstly, we refer you to the sleep clinic. Okay.
Mm-hmm.
They will perform more detailed examination for you. And
Mm-hmm.
they'll perform something called sleep study to see if there is something wrong with your sleep itself.
Okay.
And after that, they might, if it is confirmed the diagnosis, they might give you something called uh, a device causing like help you to prevent these muscles from relaxation. Okay.
Okay. Mm-hmm.
It's important to following a healthy lifestyle and try to lose weight as possible as you can. Okay.
Yeah. But I'm controlling my diet, doctor. So how can I lose weight?
Yeah, yeah, I understand this point. So actually we have done.
Move on to the next station.
Time's up. Thank you. Thank
Thankfully,
you, Dr. Marina. So, how do you feel?
actually, I am very confused. So first of all, I was thinking it is type 2 diabetes case. I was planning to talk about healthy lifestyle, and I was planning to start him on metformin as the hemoglobin A1C is a little bit on the higher side.
No, it's normal.
45. Okay, so that's, yeah, maybe that's my mistake.
Uh,
Okay.
It should be 48. Okay,
Okay. Okay.
around 48, more than
Yeah.
48, then you can be
Okay.
concerned. Even this patient is not very old, not very young.
Yeah.
So from 48 to 58, it's okay.
Okay. So yeah, that's my fault then. So
Yeah.
I think my data gathering was just haphazards from here and there.
Well, it was good, apart from one question, and I was
Mm,
shocked when you asked me
yeah.
this question. What was the
Sexual
question?
history. Yeah,
Yeah.
I felt that you read something. So yeah. Actually, one time I just read that obstructive sleep apnea might cause a problem with erection or something like that.
Begin.
So yeah,
Okay.
I heard it once, so just
All
it
right.
came to my mind. Yeah, that's it.
Okay.
Mm.
Partly right, and I do agree with you if you are in the real life. Okay.
Yeah, yeah, yeah. But there
But
is no point
here
of
you
that
have to
here.
be very focused.
Yeah,
Okay.
yeah,
You have
yeah.
8 minutes to finish. All right.
Yeah.
Even when you talked about giving me CPAP or devices and these things,
Yeah.
it's to be honest, if I were you, I'm not going to talk about them. What
Yeah.
was important to me is
Mhm.
talking about the lifestyle and exercise and referring
Yeah.
the patient to dietitian. Okay.
Yeah. Yeah.
All right.
Yeah. Yeah.
Yeah. So, okay, but good, good. You've done it really good. Okay, reasonably well. Right.
Thank you.
So yeah, they've given you this information just
Yes.
to help you. Okay.
Okay. Yeah.
All right. The hemoglobin A1C is normal.
Yeah.
And he has well-controlled diabetes. He told you it's well-controlled, and I'm going to the follow-ups and everything is okay. So the main problem is the body mass
Yeah.
index with the symptoms that he has,
Yeah.
sleepiness and tiredness.
Yeah.
I would love if you ask me about the possible causes of tiredness.
Yeah.
Patient has tiredness. So
Yeah.
follow the structure of tiredness. Since when you have this tiredness? You asked me about since when you have this tiredness, I think. No, you told
No, I
me.
don't ask. No.
Yeah. Since when
So
you have
yeah,
so,
yeah. I
yeah,
will ask after you finish. Okay.
yeah. Since when you have it, um and do you have any um weather preferences?
Yeah.
Do you snore? You asked me about shortness of breath. That's why I
Mm.
told you about snoring. If you didn't ask me about why did you ask me about shortness of breath? Is it because anemia?
No, I was taking it towards hemoglobin A1C is elevated, so I'm asking complications of diabetes. That's why I asked weakness,
Mm,
headache. So is this information just take my
yeah,
mind to another place? Yeah.
yeah. Okay. So ask me about the symptoms of hypothyroidism and the symptoms of obstructive sleep apnea, especially the body mass index is high.
Yeah.
In tiredness, in general, in
Yeah.
any tiredness, you ask about snoring and
Naps in the morning, I think.
thyroid, okay,
Yeah.
and cancer symptoms. These are the
Yeah.
symptoms that you ask about in tiredness, okay?
Yeah.
You went through the complication of diabetes, which is not really relevant
Yeah.
in this case. It is
Yeah.
controlled,
Yeah.
okay? So one or two questions about the complications and it's enough, all right?
Yeah. Okay.
Did that happen before? Any medical conditions, medications, personal history was okay, psychosocial as well, and driving, everything was good, 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 good. What you've missed are the structure of tiredness.
Yeah.
You ignored the tiredness, okay, and um, sexual activity is not important.
Okay.
ENT examination.
Yeah.
Okay, ENT examination. You can ask about thyroid function tests and vitamin D for tiredness.
Okay.
Okay. So this is in the data gathering. Management, it is obstructive sleep apnea. Yeah, good. It's good that I've reached this diagnosis. I'm happy with that. I'm totally happy with it. Okay. You refer me to the sleep clinic, okay, and you give me an advice about lifestyle and driving.
Okay.
All right. It's obstructive sleep apnea case, okay, but it's hidden in this question,
Yeah.
right?
Yeah. Yeah. Okay.
Okay.
Yeah.
So
Okay.
yeah. Would you like to inform the DVLA or
Yes.
just advise me about stopping driving first?
So I'll advise them to stop driving first until the confirmation of the disease, then we will discuss with the DVLA.
Okay, good. All right. Yeah. And the referral of the for the specialist. If he
Mhm.
asks you, is it urgent, or when are you going to refer me?
To be honest, I don't know.
Well, it's urgent in this case because the patient is taxi driver. It might affect his, you know,
His job and his life.
safety, okay?
Yeah.
So urgent referral to the sleep clinic. All right.
Okay. Thank you, doctor.
Okay, thank you, Dr. Marina. Well done. Well done, to be honest. Well done. Okay,
Thank
good, good. Keep it up.
So can I just ask one question?
Yeah.
In the beginning of the case, I said like you have diabetes for quite a long time. I felt the beginning was not good.
Yeah,
So yeah, he's
you
here
assumed.
for he here for follow up. So for what? I didn't understand this point. I didn't know
Follow
how
up for
to
his
start.
diabetes.
Okay, yeah. So shall I just start it by understand that you are here for follow up? So how are you coping with diabetes? That's it?
Yes, yes.
Okay. Okay.
Yeah.
Thank you, doctor. Thank you.
Thank you, Dr. Marina. Okay, data gathering. I will take 2 marks in the data gathering.
Okay.
Okay, and we have talked about what you've missed, all right?
Yeah, yeah. Okay.
Management skills. Referred me, gave me the diagnosis. You talked about the lifestyle a bit, so I
Mhm.
would say 3 in the management,
Okay.
and interpersonal skills 3.
Okay. Thank you, doctor.
Okay,
Thank
all
you
right.
so much. Thank you.
A tick in consultation.
Yeah.
You asked some irrelevant questions and you ignored important points. Yeah. Okay.
Thank you, doctor. Thank you
Thank
so
you,
much.
Dr. Marina.
It's really helpful. Thank you.
All right, let's do the last one. If you have any question, doctors, just write in the chat box and we are going to answer or to discuss your questions. The last one is Dr. I can't remember.